My name is Werner B. I'm 85 years old and I originally came from Germany, but that was a long time ago. I went for a normal annual checkup to the doctor, and during the conversation I said to her, I have a bit of problem swallowing. And she said, oh, it's probably an infection, it will go away. But if it doesn't, I give you a referral and you can get a test done. And the result of the test was that it's a malignant growth, not a polyp. Well, that's when it all started, of course.
Look, when we found out Dad had cancer, we were all obviously very concerned for his future and his well-being, and for the family as a whole. And we all had different roles to play in trying to get to a good outcome. Dad's been good about it. He's been to the hospital when he's had to be to the hospital, and they've done a great job.
I had chemotherapy and I had radiotherapy. It all started with the swallowing problem. Because I couldn't eat very well, without knowing what it actually was, I already lost about 8 kilograms before I even had treatment. Since it all started, I've lost about 10 kilograms. But it has been fairly stable in the last few weeks.
Weight loss is very common during cancer treatments. Reasons for weight loss are usually multifactorial. For example, nausea and vomiting often results in reduced intake of food and can result in people losing weight. Research shows us that people who lose weight during treatment are more likely to develop malnutrition. Literature also tells us that people with cancer and malnutrition have a poorer quality of life, reduced tolerance to treatment, and are more likely to have unplanned interruptions to their treatment schedule.
You don't really feel like eating. You might as well go hungry. You're not hungry anyhow because it's too difficult to swallow. But I realized it had to be done. I had to eat. I had to keep up the weight. And so, pureed food or not, I only could eat pureed food. I just swallowed it and had my desserts afterwards. And just again, about 3 or 4 times a day.
When trying to gain weight, there are a few strategies that may be helpful. Be mindful your body may require more nutrition or fuel than what it did previously. This is due to the burden of cancer and the cost of the body to make new cells. Gaining weight can be a slow process. Consistency is the key. It is really important to be consistent with your nutrition across the whole week. For example, if you eat well for 2 days of the week and eat poorly 5 days of the week, your weight will be unlikely to change. If your appetite is poor or it's challenging to get extra calories in, food that contain high amount of energy and protein can be added to your meals to add extra nourishment.
Mum's really good at preparing the pureed food for him and getting the food on the table, making sure Dad has his sustagen and all the good things that he's supposed to have and keep him fit and healthy and strong.
The key is using high energy and high protein strategies to add extra nourishment to your meals. More calories in for the same volume. Examples of high energy and protein foods include honey, cheese, cream, chia seeds, nuts, oils and nut spreads. These foods are very calorie dense and can add a lot of calories to your meals without increasing the size of your meals significantly. A typical breakfast of Vegemite on toast contains 150 to 200 calories. However, if you add cheese, this will increase the meal to 250 to 300 calories. Another example is cereal with milk. In a typical serve contains 200 calories. However, if the milk is replaced with full cream milk or a protein powder used in the milk with some honey, this will add 200 calories, making it easier to meet your daily requirements. Being active and moving the body is an essential part of increasing the strength of your muscles. Recovery nutrition provides your body the building blocks to help your muscles recover.
I came to the conclusion the body is like an engine. If you like the food or not, doesn't matter. but it needs fuel, so just eat.
Be mindful that activity burns calories or fuel, and this needs to be replaced in addition to what you would normally consume to assist not only with your muscle recovery, but also weight gain. For more information on recovery nutrition, see our Nutrition in Exercise video.